One of the biggest reasons people's mental health gets worse isn't always the condition itself, it's the wait. Too many spend months, even years, bouncing around the system. They're told they don't meet the threshold here, sent to another service there, or left on endless waiting lists. In that time, what could have been treated early often escalates into full-blown crisis. It doesn't have to be this way. Imagine if every town had a walk-in advisory hub, a place where anyone could go without a referral or a GP appointment. Somewhere you could walk into on a Tuesday afternoon, sit down with a trained advisor, and leave with a clear plan for support. Crisis cafes and safe spaces could also become the norm, not the exception. Picture a young man on the edge of breaking down at midnight. Right now, his only option might be A&E, a place already stretched, noisy, and not designed for mental health emergencies. But what if instead he knew there was a crisis cafe open nearby, calm and welcoming, staffed by people who know how to handle that moment? That single change could save lives. And this is where technology can play a role too. AI could power a simple triage system. You type in what's going on, I can't sleep, panic attacks every night, and within seconds you're directed to the right local service, not left to trawl through dozens of websites. That kind of smart routing would cut wasted time and make sure people get to the help they actually need, faster. When people ask why more hasn't been built, the answer is often framed as because of the charity commission. But the truth is, it's not the regulator that's holding the sector back, it's the way we operate within it. A lot of boards are risk-averse. Trustees worry more about not rocking the boat than about driving bold change. So instead of thinking about building something lasting, money is channeled into safe, short-term projects that tick the right boxes. The funding system doesn't help either. Government contracts are usually short-term, 1 to 3 years, and heavily restricted. That means charities spend their energy scrambling for the next tender instead of planning 10 years ahead. And because these contracts are competitive, organizations end up working against each other, duplicating services like helplines or awareness campaigns just to stay visible, rather than collaborating on infrastructure that would benefit everyone. So what would breaking through these blockers look like? Imagine if contracts were written differently, 10-year agreements that gave charities the stability to plan and invest in actual buildings, not just temporary programs. Or picture a shared national directory, instead of 10 different helplines all advertising separately. That would cut confusion for the public and save money that could be channeled into crisis hubs or advisory centers. The blockers aren't immovable walls. They're just the habits and systems we've built around ourselves. There's also a mindset issue running through the sector. Too many leaders stick to the same familiar playbook, lobby government, run another awareness campaign, deliver light-touch services like toolkits or short courses. All of these things have their place, but meanwhile, people with the most severe needs are still left waiting. The danger is that this cycle has become comfortable. It's safer to produce a glossy campaign than to commit to building a crisis hub. It's easier to measure social media impressions than to ask whether someone in psychosis got the care they needed at 3 a.m. And while charities play it safe, trust from the public is quietly eroding. People are asking, if billions are flowing through the sector, why can't I get help when I need it? But it doesn't have to be this way. Imagine if the sector came together to set up an innovation council, a space where leaders, people with lived experience, and frontline staff could design bold infrastructure projects instead of just the next awareness week. Or what if we started publicly celebrating the organizations that open new facilities, build safe spaces, or create lasting community hubs, not just the ones with the slickest campaigns? That kind of shift would reward courage, not just caution. Of course, buildings alone won't solve the crisis. A crisis hub is just bricks and mortar unless there are people inside it who know how to help. And right now, we don't have enough of them. The UK faces a shortage of psychiatrists, mental health nurses, and crisis-trained professionals. A hospital may technically have beds, but they're closed because there aren't enough nurses to staff them. So what could change? Charities could start investing directly in people, not just projects. Imagine if part of the sector's unrestricted income funded bursaries or apprenticeships for mental health nurses tied to new hubs. or if charities partnered with universities and NHS trusts to create joint training academies, places that prepare the next generation of crisis workers, peer supporters and clinicians.